Welcome everybody to Black Men's Health. We are joined by our illustrious guest, Dr. Lisa Bowleg, who's going to talk about Black men and the issue of HIV in the community. I'd like to first start by reading off our bio of Dr. Bowleg. She is currently the founder and president and co-director of programs for the Intersectionality Training Institute. She's a professor in the Applied Social Psychology program at the Department of Psychological and Brain Sciences and director of the Social and Behavioral Science Core of the DC Center of AIDS Research at George Washington University. A HIV prevention and critical health care equity researcher, Dr. Bowleg has more than 20 years of experience and expertise applying intersectionality to health equity research with Black heterosexual men and Black lesbian, gay, and bisexual men and women. We are pleased to be joined by Dr. Bowleg. And before us today on this panel, we have he should be a doctor, our founder for Black Men's Health, John D. Brown, who is the man, and I am Takuma Roback, the EIC of Black Men's Health. And to get started, we like to do an icebreaker question. So I want to read to you a quote, Dr. Bowleg, and we'll go off of that. When I dare to be powerful, to use my strength in the service of my vision, then it becomes less important whether or not I am unafraid. What does that quote mean to you?
Oh, that quote is everything to me. That is a quote from the formidable Audre Lorde. It's a quote of hers from a conference, and it's particularly meaningful, and you've done your research, obviously, because it's a poster that I have carried with me from every office that I've had, and it's a poster that I look to remind me that how important it is that I serve my vision. It doesn't matter if I'm afraid. Lots of times I got to get into things, whether it's how I write, what I'm writing, how it's going to be received, and how people think about it or respond to it is not my business. And so that quote reminds me to really be true to myself and to really try and emulate the warrior stance that Sister Lord taught us to emulate.
I love it.
What a wonderful place to start. That's great.
I said a little bit offline before we got started. We had the opportunity to interface with Dr. Bowleg previously with the project where we were talking about HIV and AIDS, and called Dr. Derek Griffith, who's now at Georgetown, and somebody that we respect and trust, especially as it relates to men's health and specifically Black men's health. And asked him about some experts, and he said Dr. Bowleg's name twice. He said it twice before he even, went on from there. So we are grateful to have you, Dr. Bowleg, and again, so happy to work with you previously, and wonderful to have you in this space also. So thank you for your time.
Thank you. I'm happy to be here.
Right. I guess we'll get started with the main questioning. So I want to ask you, what was it like growing up in the Bahamas when you think about being back home? What images come to mind for you?
Oh, God. First and foremost, ocean. This is my home office, and this color, I chose it to really try to evoke the sea. It is just, the Bahamas is a stunningly beautiful place. And even though I've now lived in the US longer than I lived in the Bahamas, I lived there until I was 18 and left for college. And so I get to go back often, and I am just struck by it. It is a stunningly beautiful place. So there's that, and my connection to the ocean, which is really deep. My family, all of my family is still there. And so, and I'm especially close to my sister. And so it's just a place of, I speak differently when I'm there. I sound more Indian. You might not understand me.
Turn it on. Turn it on.
Yeah. And just last, we speak often. And so we were just speaking last night, and just the rhythm. And so to be in a place where that just happens naturally. The food. Woo,
Oh, the food.
Yeah, now look, we're not about health there. You know, we're the land that we believe.
It's about balance.
in the
It's about
crack-
balance. It's about balance, Dr.
Exactly.
Bowlake.
But we don't do balance because
Right.
we will do the baked macaroni and cheese with the peas and rice and the coleslaw and, you know, the meat or the crack conch or something like that. So we're not really, no. I mean, there's a reason why our rates of hypertension are through the roof. But I have really fond memories. I'm so glad that I grew up there, and I think growing up there has so much shaped how I move as a Black woman in the US, right? Because I didn't grow up having to think about race and racism in the way I have to think about it here. So I feel very much still Bahamian after all these years. Thank you.
Absolutely.
I was introduced to Johnny Cake, if I'm saying that right. Yeah, I was, and Dr. Bowlake, it was for breakfast. Listen, they referenced, they said, bring us some Johnny Cake and, you know, bring 2 pieces for our guests. And I was like, oh no, you know, we don't even know what this is for breakfast. Yeah. And when it got there, they were absolutely correct. It was so delicious.
And it's like a brick, you know, so it's like, it's, oof. Oh, just hearing you say that makes me happy.
I saw you light up. Like,
I'm hungry now.
Oh, what you know about Johnny Cake?
Yeah, a little bit. Yeah, indeed.
Wow. And, you know, when we have conversations with, you know, our scholars and doctors and experts, one of the questions we love to ask is not only who your influences were coming up, but how did your childhood help shape your intellectual interests?
My childhood. That probably would be certainly my parents. You know, my father is this sort of bibliophile. My father's the guy who's got 5 books that he's all reading at the same time on his nightstand. And I mean reading. In fact, he's one of the most well-read people I know. And my mother so I grew up in a household where you were going to college. It wasn't if, you know, that was well known. And then there's my beloved grandmother. My grandmother was this sort of really respected, valued English teacher. She's the one who taught English to all of the people who would go on to be leaders. And she also, so, you know, proper English and proper writing and we would go to my grandmother's house after school pretty much every day. And so I just grew up around, and she would tutor, right? And so it was just always people reading and talking and encouraging my writing. And it's, you know, the British school system. And so, you know, that precision on grammar and writing. And it was just part of really seamless part of my childhood.
Like the intellect, the rigor was, it sounds like the rigor was developed in those years.
Oh yes, and that is something that's still very much with me. All of my students or anybody who's worked with me or who's been edited, they call it being bow-legged. Because you know,
you got a verb. You got a verb.
That's right. Attention to detail.
That's right.
And
thorough.
Linguistic precision, and that you do it right. You know, you do it, you know, if it takes longer, the quality, it's got to be tight, it's got to be tight, it's got to be excellent. And that, I'm sure, is from, you know, growing up with my parents and my grandmother for certain.
Remember that, Takuma, that's the bar, linguistic precision, right? Linguistic precision. I love it. T-shirt. Get some T-shirts.
Well, sure. And, you know, I guess I was also one of these nerdy kids reading the dictionary just because, and that's still something that intrigues me. That, you know, there's a word for almost everything. It's just a precision of language. It's important, or at least it's important to me. I'm sure it drives, you know, my students and other people crazy, but it's important, I think.
It's important to me. Words matter.
Words mean things. They matter. Yeah.
I have as Takuma knows, I have a 15-year-old. He just turned 15. Takuma on Monday? Yeah, on Monday, the 8th. And my wife and I, you know, just poured into him, just read, which is fine. And you're super excited when, you know, those words start coming back at you. But as they get older, all those words are in there. So there are more words coming back now, which are like, gave him a lot of ammunition along the way.
Yeah. Be careful what you do, right?
Yeah. but it's good. It's good for them to have it, and I'm so glad that somebody gave you that gift. I mean, even when you talked about your father, if he's a reader like that, just even seeing that and being around it, even that can just become a part of who you
And that's
are.
my nightstand, right?
Yeah,
I
the
got
norm.
3 books, and
That's right.
downstairs I have a morning ritual. There's 2 other books downstairs. So, it's part of my life
Yeah,
as well.
this is your environment. This is
Yeah.
what you know. Yeah,
Yeah.
I love it. I love it.
I'm curious. So you said that you stayed in the Bahamas until you were 18. So I have to ask, how did the opportunity to attend Georgetown University come about? What was that like?
There's a story there. So, well, my first place, I landed in University of Hartford, and people always in Connecticut, and people
Mhm.
ask, "Well, how'd you get there?" Well, because I had an aunt there. And so that Bahamian connection, first time leaving home, well, not first time leaving home, but no, I mean, not first time traveling to the U.S., but certainly first time leaving home. And so I wanted to be near family, but I was in West Hartford, Connecticut, and I was like, "Oh no, this is not."
Freezing, I'm assuming.
Yeah, pardon me?
Freezing, I'm assuming.
Freezing my butt off. And that was the first time I saw snow. And I thought, no, this is not going to work. And so there's a large contingent of Bahamians at Georgetown
Oh.
because, of course, Catholic University, Jesuit connection.
Mhm.
And so there were a lot of Bahamians there. And then I went, and I'm a hopeless sort of romantic. And I go there for the tour, and the bus turns, and I see those
Yeah.
flyers, and I saw that campus, and it was in DC. And so I transferred as soon as I could. And that was, I spent, oh God, you're taking me back. On Friday, I didn't have classes on Fridays. And so what I would do is take the bus, take the metro to go down to the museums. And I would spend like in the National Gallery of Art. I mean, I'm talking about hours, just was such a wonderful place to be. And Georgetown was great, but also being in DC.
Yeah, I was gonna say it's a lot to do in DC. It's a lot to take in.
And a lot of that stuff is free. And so
Yeah.
you could go and spend an entire day at the museums of your choice for free.
Yeah.
Yeah. So that's
Yeah,
how
it's
that's
amazing.
how I got there.
DC is like one of my favorite cities in this country. It's amazing. The
Chocolate City.
food,
The
Chocolate
Chocolate
City.
City.
Yeah, no, it's not Chocolate City anymore.
Well,
There's
yeah.
I understand. I understand that's the case. Yeah.
But still, it's still,
Yeah.
yeah.
Yeah, U Street is looking a lot different
Right.
than than the 90s, you know.
Yeah, true, also true.
Doesn't quite look the same.
Indeed, indeed, indeed. I wanted to tell you, I really enjoyed reading The Master's Tools Will Never Dismantle the Master's House. And when I was reading it, in it you mentioned how you took some courses in women's studies and how it kind of informs your approach now. Can you talk about what that experience was like and how it transformed you as a scholar?
Sure. I tell everybody, particularly my undergraduate students, take a women's studies class because it was the first place that I learned how to think critically. And by critically, I mean looking at structures that are, and critiquing structures like racism and sexism and all of the systems that try to keep those things hidden from us. And so I learned how to think just critically about patriarchy, about racism, and about intersectionality in women's studies. And there was she's still very much a part of my life, Margaret Stetz. And so I walk into this intro to women's studies class as white woman, and she is so sort of disarming. You look at she's so dainty, and she's a Victorian scholar, but fire. I mean, just radical. And so she says to me, throughout class, she said, "So have you read any of these Black feminist scholars?" And no, I hadn't. And she invited me to do an independent tutorial. And so that's where I'm getting Audre Lorde and bell hooks and the Black feminist homegirls, the kitchen table collective. So Barbara Smith, Beverly Smith. That's how I get introduced, and just again reading. And so that even though I was a psych major, it was that experience that really sort of transformed my world into sort of how I see things critically, in terms of, you know, power and structure.
What a gift.
Speaking of gifts, this is a woman who, so let's see, I graduated Georgetown in 86. I think, no, I got there in 86, graduated in 88. And so I met her in 86 every year. And I mean, every year without fail. I get a birthday gift and I get a Christmas gift from this woman.
Amen.
Now, every year. I mean, and so it's a real bond.
Wow.
Because she was so pivotal in my life.
I
I should be giving her the gifts, but
Yeah.
she's more organized than I am, clearly.
She's got it together.
Yeah,
She's got a head start on you too, also.
Yeah.
You
True.
still have time. The gift I was really referencing, you know, in addition to everything that you have referenced, is also when you said, you know, even though I was a psych major, right? I mean, that's a gift in the sense that somebody didn't say, oh, well, you should be on this path and you should be, you know, taking this, right? I mean, you know, especially for individuals to have an opportunity to explore beyond, you know, whatever that current framework is, which is going to be different tomorrow anyway. Somebody will make it the norm later, but it's amazing. Again, what a gift that you had somebody that, you know, kind of opened up your world, and I'm sure it benefits you, as it sounds like it does still today.
It does.
Yeah.
Why applied psychology? Why did you decide to take that route?
Oh, that's a story too. So I, you know, most undergraduates, they take sort of psychology courses, and there's this implicit assumption that you're going to somehow end up being a clinician. And boy, that did not sound right. That did not feel right. I had too many strong opinions to be sitting, you know, just passively listening to somebody. So that did, and I had heard that if you want to do applied social work, applied social psychology work, you need a doctorate. But wait, this takes me back to another story. Hold up, let me I'm not a linear thinker. Like this. When my first academic job at University of Rhode Island, and my mother's up from the Bahamas, she's moving me in, and I've always kept scrapbooks and all of these things. And so she says, Lisa, look at this. And so she pulled out, it was the PSAT, you know, that's the thing you take before and I guess you have to indicate a career choice. And I had chosen in grade, I don't know what grade you take that thing in, 9, 10?
Yeah, I was gonna say 8th, 9th, something like that, yes.
But I had chosen that I wanted to be a social psychologist. Now, I am here to tell you, in grade 9, I did not know anything about social psychology. But I guess I guess I've always been interested in context and environment and that type of stuff. And so I heard that you needed to take you needed to have research experience for a PhD. And I thought, oh, okay, how do I get that? And there was a study that had been conducted. It was like a national lesbian health study that I'd read about. And I simply wrote the investigators and I said, I'm just graduating. I know I need research experience, and I see that you've done this study. This is something I'd be interested in working on. You know, would you be interested in talking to me or something like that? And they were so impressed with my letter and my initiative and that I was being proactive. And they said, well, that study is no longer funded. So that was my first lesson in learning about soft money, right? When the grant's over, it's over. But we have a job here in HIV policy, and part of it would also be administrative. And oh, by the way, it comes with tuition benefits because it's at the George Washington University. So all of that looked really good to me in terms, and so what I did before getting into psychology, again, you know, my journey has been a lot like this, was get a master's in public policy with concentration in women's studies. And then by then I was really solid, like, okay, I'm ready to go into social psychology. I now see the contribution I can make from having this women's studies, public policy background, and I'm ready to go into a doctoral program in social psych.
Absolutely, absolutely. And you know, you had referenced something earlier, and this topic has become a political boogeyman, if you will. critical race theory. And we've seen how it's been misinterpreted by people who don't know what it is, and purposely as well. We see that as well.
Or do know what it is, and they're purposefully misinterpreting it.
Yeah.
Absolutely. Can you break down what that exactly is, and again, elaborate how that's influenced your research now, especially when we talk about analyzing the structures that act in oppressing certain populations?
So critical race theory comes out of critical legal studies. And so these are people like Kimberly Crenshaw, Derek Bell, people like that. And basically what they're saying is that racism isn't this sort of anomalous, aberrant thing that just kind of, happens, but it's sort of this mundane experience for people of color in the US, Black people particularly, and that it's embedded in the legal systems. It's like it's entrenched at every juncture. It's facts. I mean, it's so basic and factual and also true. And I like how Kimberly Crenshaw, I saw a recent interview of hers about it, and she was saying, look, what we're just saying is we are all of these ideals that the founding fathers have laid out. We're saying, okay, let us see, show us this equality and that we're all created equally. Because whether you're talking about, well, I mean, certainly slavery, Jim Crow, you can just go on, the Black codes, and you could look in every domain, education, housing, name on incarceration, police, it's all, you can
Everywhere.
everywhere. And it is so deeply integrated into the law. And so that, I mean, that's all it is. I mean, well, not that, I mean, clearly there are really brilliant scholars, so I don't mean to be dismissive about it. I think in saying that, I'm talking about this reaction to the way it's been weaponized on the right. And to very, very good effect, I might add. It's an effective rallying tool for white people who are very uncomfortable with racism. And so it's no surprise that you get seconds after the Black Lives Matter movement and George Floyd, and you actually see the New York Times had a study showing that they're right after within months, Floyd is murdered in May. And so within months, support for Black Lives Matter is really high. By January of the following year, it has dropped off precipitously, particularly for white people. And that ties into a tenet of critical race theory about interest convergence, which is the notion that white people will support policies and practices that favor Black people only to the extent that it supports their interest, it converges with what they're interested in. Right?
Absolutely.
So,
absolutely.
That's critical race theory in a nutshell.
I also truly believe, and this is a whole nother discussion, there's a lot of support for a lot of things, in the summer of 2020 when everybody was locked in their homes and watching live television of cities burning, right? So when you talk about even people's interests, there has to be some discussion of an interpretation of people looking at it and say, oh, cities are burning. Like, this could be my city at some point, right? I mean, people are thinking about that because, again, the interest, when people started moving around and getting out in the world, all of a sudden the interest just died down, right? No more text to Tacoma directly or calls to John Brown like, hey, how you doing? Can we talk? All that stuff died out when the world opened back up. People were locked in their homes.
But also it's when, like, okay, I'm with this anti-police brutality stuff, but wait, now you talk about defund the police? Who's gonna come when somebody breaks into my house? My house, my property interest, so what are y'all talking about? And so that's, it raises for me, to what extent we can really count on white people who are gonna really be there and really be allies and what it means to be an ally. Because you can't run the minute, the minute it gets hot, and to see that decline for the Black Lives Matter movement. It's just like, whoa, okay.
or not even run, just choose to stand down, right? Just to choose to like,
That's right.
just choose to be neutral all of a sudden, right? That's
Right.
that's a dangerous position.
Dangerous position. Yeah. I can't trust if you're just going to be neutral.
That's right. When neutral when you choose to also, right? You have the option to be,
right.
That's the point. You have the option to be neutral, right?
Yeah. Woo.
Absolutely. Wow. I don't want to take up all the time. Well, John, do you want to jump in? You any?
Takuma's the scholar. You lead, brother. You go ahead. I want to get into some of this HIV/AIDS, but I know we are building towards that. So please continue. Because I wouldn't have heard about crack conk and Johnny cake. So
That's right.
Obviously, I'm more basic. I would have jumped into it. We've been talking about HIV/AIDS awareness, and Takuma is like riding this beautiful wave. So continue, Takuma,
Beautiful.
please.
I'm really enjoying it.
I'm hungry.
Tell you that story one day, Takuma. It was in a pool hall very early in the morning.
Yeah.
It had grape soda, Johnny cake, I think stewfish. Am I saying that right?
Oh yeah.
Yeah. All of that.
It's early in the morning. I didn't know we were gonna be eating stewfish. It was delicious. It was delicious.
Oh.
It was delicious.
All right.
We'll make sure we have a Black Men's Health activate a Black Men's Health something in the Bahamas.
Yeah, that needs to happen. Yes.
Balance.
Yeah.
All about balance. Yeah.
And this is a great segue when you bring up HIV/AIDS, because I wanted to know, Dr. Boleg, you came up through women's studies. When did that shift happen when you started focusing on Black men and HIV/AIDS in particular, and why did that shift happen for you?
Mm-hmm. So my dissertation was, so again, I've always been interested in context and relationships. And so my dissertation examined how relationship power between Black women and Black men, and also Latinas and Latino men, that whole sort of context of power and relationships and how that shaped condom use and what happens with regard to women's risk. And so all of my work was on Black women. And then by the time I was a professor and doing my own research, it dawned on me, wait a minute, why am I continuing to do all this research on women when we know so much about it? We know so much about the factors that increase risk for women. That's number one. Two, women do not control condom use. That's the other thing. And where are the men in this equation? And in particular, a lot of the research on women and HIV was talking about how conflict in relationships really meant that sometimes women were afraid to ask partners to use condoms.
That's right.
Violence.
That's right. That's right.
Women were asking. And so I was like, wait a minute, this is a lot like doing research on sexual violence just with women. I need to know, we're a Black man, I need to talk to them and find out their perspective. And then a really interesting thing happened, but I see you have a question.
Oh, I know, I just love that term, conflict. That's so deep, right? Because you said conflict and you could easily get into sexual violence and other things of that nature, but even conflict in the sense of just like, you don't even want to have a discussion about it. Like, I don't even want to hear this today, right? Like, we're going to start fussing and he's going to be mad and whatever. That's conflict also, right?
So exactly.
Yeah, when you said women don't control condom usage, my initial reaction is like, they could, like, stop, no, this ain't happening, right? But you're right, if it becomes a discussion that now we're not going to be talking or we're going to be fighting or whatever, it could easily be like, whatever, let's do this. And which is unfortunate because people need to stand on and respect, what's going on. Yeah.
And I did, qualitative research where I did interviews with Black men and women in relationships. And I published a paper on this. And one of the things I was struck by was with men, their decision to use a condom, it's simply, oh, I just go and get it. But with women, it was just all of this, having to talk about it or not talk about all the stuff you just mentioned. There was just so much. It wasn't always as simple. I mean, sometimes it was as simple like, you better use this or we're not having sex. But it was a whole other thing for women. And this was not just my original idea. Hortensia Amaro, who's a psychologist who wrote this paper called Love, Sex, and Power, and was published in American Psychologist in 1995. And it was also really influential to me in thinking, oh, I think I want to do a dissertation on this topic. And so she had sort of laid that out theoretically. And I just, in looking at how men and women talk about condoms, that was also clear in my research.
And there was a certain point that you did field research, is that right? Where you spoke to Black men about their condom usage and their behaviors.
Lots of.
Um,
Mhm.
can you talk about what you gleaned from that experience?
Yes, I can tell lots. So I did that study that I told you about that was in DC, and that was with Black heterosexual men and women. And then I got my first National Institutes of Health funded grant. And that was a study of a 3-year study in Philadelphia. And I was very much interested again in, okay, gender ideologies, gender roles, masculinity. How do, what's Black masculine? What does that have to do with condom use and all that? And all of my studies involve qualitative research. It's just it's so important. I mean, most psychologists just sort of dive in and do quantitative surveys, statistics, all of that. But, a qualitative approach is a totally different way of approaching a subject. Number one, you admit you are not the expert. Like, I'm not a Black man. Well, I've not had that experience, and so I trust that the Black men that I talk to, they're the experts on their lives, and I have a lot to learn from them. And so it's a whole different framework and stance for how you go into research. And so I did focus groups and individual interviews, and you get different types of information from that. In individual interviews, you get more sort of personal narratives. Also in those, we asked really intimate questions. I mean, we wanted to understand what happens, like take me through from the date to the orgasms, and so we really did, and so you don't want to do that in a group. But then we also do these focus groups, and focus groups are really good for understanding norms and how, what are the sort of shared norms, beliefs, and also watching how people agree and disagree. And that part of the research was so fundamental to me, because it's when I realized, oh, wait a minute, you get Black men talking really, and you're asking them about condoms. And within 5 seconds, you're talking about, I can't get a job because I have a criminal record. You're talking about unemployment. You're talking about structural stuff. And that's when I realized, wait a minute, this psychology with this really narrow focus on the individual as the primary unit of analysis, this is not going to tell me what I need to know about condom use. There are factors beyond the level of the individual that shape, the decisions people make, and how, or constrain the ability to engage in protective behaviors like using condoms. And so that's how I really got into structure. That first study was just really pivotal in making me realize, as an HIV prevention researcher, I need to understand this larger context of what it means to be a Black man in the US and how it shapes health.
Absolutely. And in talking about those structures, I know that did you encounter someone who said the police is the forefront going on down here 24 hours a day? They ain't gonna be thinking. You can't see the AIDS coming. You focus on what you're dealing with here. And basically the person said, I would say today that as a Black man, I got 99 problems and I sure ain't thinking about HIV at the end of the day. Can you
Correct.
talk? Yeah. Can you talk about what that quote, how that quote speaks to the state of the HIV/AIDS epidemic with Black men in the community?
Well, yeah, I mean, I think that quote, which is from a study that I did, another NIH funded study that I did in DC. And again, I wanted to understand neighborhoods and what does a neighborhood have to do with HIV? And that quote encapsulates it so beautifully, right? This notion about, well, first of all, why vantage point is so important. And by that, I mean, researchers come in with we get funded, right? NIH is not NIH did not give me money to find out about the police. NIH says, look, we want to know about condom use and how to increase it in this population. There's populations that increase risk. But it's what that quote says is, we need to really understand any health issue from the perspective of the person experiencing it. So to go in and talk to this person about condom use, where for him, what he's talking about is police, well, he's not talking specifically about police brutality, but he's talking about this sort of omnipresent state of being harassed or the threat of harassment, of what it means to be a Black man. And that quote, I mean, that's one of the most illustrative ones, but that experience has come up in every single study I've done. It's come up in the research in Philadelphia. It's come up in research in DC. It's come up in another study that I've done since that one in DC. And so that then led me to do some work on police brutality and Black men's experiences of police, you know, just this constant harassment, surveillance, and all of that. And so the notion that HIV is something, you can't see it. I mean, it's not something, you know, for most people, it's this really distant threat. But certainly, you know, it's many cities. You got to watch where you are. You have to be doing this constant self-monitoring to make sure that, you know, the police, right? Yeah, exactly.
Continued navigation
And
all day long.
Stress. I mean, the absolute stress that puts on Black men, but also, you know, Black women and Black trans people, you know, that of always having to be on guard and constant, you know, flight or fight. I mean, it's quite, it's a pernicious health threat. And so that's what that says.
That's an interesting perspective related to the reality of safety, right? Life safety and priorities, right? Like, how can that be a priority if the priority is like just survival, right? Like, that's, you know, if I'm in a jungle somewhere, am I worried about the little plant that's poisonous when there's a lion around the corner? It's like, let me focus on the lion, right? And maybe I deal with this poisonous plant, just try to stay away from it, right? So yeah, life safety and priority, that's a reality there.
And we did, and so because of that, what we did is we created these measures based on negative police experiences, and then also things that men in the focus group said they did to avoid the police, right? Watching how they dress, watching how they drive. And then we did some analyses where we wanted to look at incarceration, the link between incarceration history and depression symptoms. And what we found was the relationship between those things went through negative police encounters. So that men who had more negative police encounters and men who wanted to avoid the police, that was the link between that mediated the relationship between the incarceration history and the depressive symptoms. And then we also looked at unemployed men, and we found that experience was especially salient for them. And what's sad about that is that when I think about the experience of being unemployed, then, you know, you probably want to go out and get social support, but these are men who are staying in their houses because they have a criminal record. They don't even want to risk what could happen just going outside the house. And that's been the other thing, you know, in the focus groups, men talk about, yeah, you know, I'm sitting outside my grandmother's house and here the police come up. There's 3 of us rolling. I mean, you know, just these like basic mundane experiences. And so police stuff is all over our data all the time in our HIV studies.
That's why men and women of color are so just over it when it's happening, right, in the moment, because it's like you just said it about, hey, let me watch the way I dress, let me watch the way I drive, let me watch the way where I go, and then all of a sudden it's like I'm in the mall, I'm in the middle of the mall. Like, what's right? So by that point, like, I'm ready to snap, because it's like, yo, I've spent like a lot of my life trying to avoid the situation, and I'm not doing nothing. Now I got to deal with this. Like, it's just too much.
Right. Which is why respectability politics, you know, just doesn't work. You know, think about pull up your pants and all that. It doesn't matter. You got on a suit or you got your
it
pants
does not
back.
matter.
It doesn't matter. Or you're very polite or you curse them out.
No,
it just doesn't. It's not going to save you, because the problem, as they see it, is the skin color. That's a fundamental problem. It's not how we're acting, because they don't see us as people.
And by the way, Takuma, let it not be lost on anybody that in this discussion, Dr. Bole referenced earlier, my first NIH grant, and then reference later another NIH grant. So respect, Dr. Bole. Amen.
Thank you.
Indeed,
Funded,
yes.
right?
Funded, yeah.
Not applied, funded grants. Amen.
And I've been consistently funded by NIH since 2007.
Mm. Wow.
That's awesome. Respect.
Thank you.
Wow. If we could do a fill in the blank exercise, and please let me know if this is too constraining. But if I were to say the prevalence of HIV/AIDS in the Black community is the way it is because of blank, how would you complete that sentence?
I would say the vestiges of structural racism that ensure that whatever health outcome it is, oh no, I worried that this would happen. Hold on 1 second, I'm so sorry.
Don't worry, I got an alarm going off downstairs. Just a second also. You keep it moving, Takuma.
Okay.
And guess who it was? It came up as Hoya Saxa, which means that's Georgetown University calling.
Oh, wow. Okay.
Calling for money, but if I had to guess. So I would say that whether it's HIV, whether it's COVID, whether it's diabetes, that, you know, the vestiges or the legacy of structural racism help explain why the prevalence of HIV is higher in Black communities in the US than say white communities. And so the issue there is, okay, wait, you asked me to fill in the blank. I'm getting ready to go to a whole paragraph. Shall I?
Oh, please, please.
Okay. The issue is that, and HIV is so densely concentrated in Black networks, right? And so what that means, there's this wonderful study that I cite all the time by Hull Force. It was published several years ago in the American Journal of Public Health, and it was a nationally representative sample that looked at, I think these were Black heterosexual young adults and white heterosexual young adults. And what they explained and what they showed by their data is that because HIV is so densely concentrated in Black neighborhoods or Black communities, think about the young Black girl who is having sex for the first time, right? So first time, if she, because of racial homophily, so Black people tend to have sex with other Black people, her risk of getting HIV is so much higher because there are more Black people with HIV. White people, however, it's not as densely concentrated in their network, so they have to be engaging in real, you know, lots and lots of risk before white heterosexual people can be, you know, can contract HIV in the same way. And so I think, so, you know, those of us who do this work think about it more in terms of sort of networks. Also, the research shows, particularly with Black men, the research shows that Black men consistently report more consistent condom use compared with white men. They report, and I'm talking about these are Black sexual minority men I'm referencing. This is work by Greg Millett, who's consistently done work in this area, showing that they consistently report, say, fewer sexual partners compared to white gay and bisexual men. But again, this notion of densely concentrated, right? It's so prevalent in our communities. It means that you're much more likely to encounter somebody with HIV in a sexual relationship.
And you know, that there's something about this too, because it's, when this is usually reported, it's like the solution is, well, you have to change your behavior, right? It's always stressing our behavior. Can you like further elaborate on these structures really not only impacting these behaviors, but even when we try to change our behaviors, when we try to exhibit some resilience in the face of a scourge, how these structures can still thwart those efforts?
Yeah, well, I mean, an obvious choice is what's happening with pre-exposure prophylaxis, right? So this is the pill or the injectable that you can take, particularly if you're in a, well, I really hate the term high risk, but if you're, at greater risk for HIV, right? And so PrEP is for HIV negative people. And it's highly effective. It's really effective. But the studies are showing that PrEP, Black men, even Black men with health insurance, have less access to PrEP than white men. Now, and even though white men, again, because HIV is not densely concentrated, I mean, no, all gay men are, or the rates of prevalence are higher among sexual minority men in the country, all of them, but they're highest for Black sexual minority men. But even when they have health insurance, the research shows that physicians are less likely to talk to Black men about PrEP, that Black men run into all kinds of stereotypes about them being more promiscuous, things like that. And so that's an example for me of a serious barrier, because there is some technology, there's this biomedical technology out there, but also, or that Black people are not getting the information through the same channels. Um, and PrEP is not like, PrEP not like Ben-Gay. You don't just walk into the CVS and pick it up. It has to be prescribed to you. And so
Mhm.
this tells me that there's this whole system that's set up to ensure that, you can't even get the thing that's needed, that's going to really help you. The other barrier, the other structural barrier is that in states that didn't expand Medicaid, right? That's if you happen to live in one of those states, that means that that's really sort of cut off for you because it's incredibly expensive. So that's another sort of structural barrier that explains why, Black men, particularly Black men who are living in these mostly southern states that didn't expand Medicaid, don't even have access to this sort of, you know, this protective technology.
Mm, mm. It's such a motif when it comes to various conditions, lack of access to quality health care. We've talked to doctors who work in prostate health, diabetes, pharmacists, and it's like that running thread throughout this whole conversation, that lack of access, those structural barriers that you mentioned.
But like you said,
Um,
but then people are quick to say, oh, well, why don't your people just wear condoms? Or why won't you go to the doctor? Why
yeah,
won't you, all of that, when there are so many barriers that explain why people would not want,
yeah,
those aren't accessible to them in the same way.
absolutely, absolutely. And it's amazing that it's 2:52 now because it doesn't feel that long. It's so
I
crazy.
know.
When you
But
said 30, 40 minutes from the beginning, I was
I
like, okay.
did, didn't
I was like,
I?
okay, let's see how this goes.
Yeah, right,
I
right.
didn't think it was gonna be 30, 40 minutes. I didn't think it was gonna
Telling
be
me
30,
with
40
these my
minutes long.
long answers, like,
No,
I want to give
keep it
short
Not
up.
at all. This has
Keep
been
it
a
up. Keep it
delight.
up.
Um, so Black Men's Health, I would imagine is mostly Black heterosexual men. And John, correct me if I'm wrong, maybe the demographic runs between 29 or 30 to 59, I would think. It's pretty wide, with most of our readers probably 35 plus. And so we tend to be very um, myopic in terms of what's going on with us. My question to you is, for a Black heterosexual male who may be wondering about the spread of HIV, why or can you explain to them why the spread of HIV/AIDS among Black bisexual, transgender, Black gay men, why that's also impactful for us? Can you just make that connection? Why we should really be concerned about that as well, even though we're not in that group or demographic.
Well, I mean, I think my most immediate answer is they're your brothers. That's your father, your cousins, your little brother, and so
Yep.
there are other Black men. That's first and foremost. That's why you should care. That's one. But two, the same way that the system erects barriers for Black heterosexual men, it erects those barriers for Black men at these different intersections, Black men who are sexual minority and who are gay, bisexual. I mean, the CDC a few years ago came out with a statistic that if current trends persisted, 1 in 2 Black gay men would contract HIV in their lifetime. That's
Wow,
astonishing.
1 in
Because
2.
this is a tiny, tiny population to begin with. And so you can't say that you care about Black people and Black communities and Black communities if you don't care about your Black gay and bisexual brothers. That's not.
Did they have a timing on that, Dr. Bole? Like if it continued to trend by 2050 or 20?
I don't, yeah, you know, I can't remember, but you can look it up. I mean, it said, yeah, it was, it came out at I think this was like in 2020. It was before, oh boy, I hate when we do this, before the pandemic. I think this was like for like 2017, 2018, right? And so I think it's also important for Black heterosexual men to realize that our struggles are all connected. You know, when the police are pulling over, they're not necessarily, I mean, unless, you know, unless you're gender non-conforming in some way, they're not necessarily concerned with who you're having sex with. Those struggles are absolutely interrelated. And, you know, the Black gay community, they show up for Black heterosexual men when something goes down. They are there. They are at the protest. They are there. And so out of
because it's just Black people.
Yes.
At that point, it's all us.
And they show up, yeah, but Black heterosexual men don't show up for Black trans women and Black gay and bisexual men in the same way. And so you can't talk about, and Black women when Black women are murdered, or and so you can't talk about loving the Black community and expecting everybody to show up for you when you're not showing up for everybody. And so that's what I would say about that. As you can tell, I don't have much room for homophobia and biphobia. We do not have time for that. We need all of us in this struggle. So I don't know if that answers your question, but that's how that's my heartfelt response to it.
Yeah. Wow. That's.
You stuck right at 1 and 2. Yeah. No, it's yeah.
Woo,
but it's
wow.
but it's the same. But it's sort of again the intersection of racism with that of heterosexism, and throw in poverty, right? And so most of the cases we're seeing are in the South. Right. And so it's, again, if you take a structural view, that makes sense. And so one of my other studies we're doing now, we're creating measures of intersectional stigma, multi-level intersectional stigma. And our sample is young Black gay men gay and bisexual men and other men who have sex with men in Jackson, Mississippi, but also DC. And so when you look at the resources that what it means to be a Black sexual minority man in DC has, I mean, there's an organization called Us Helping Us in DC. It's primarily for HIV prevention for Black sexual minority men. There's Whitman Walker Health. There are all these resources versus, can you imagine being in like rural Black, gay in rural Mississippi?
Right.
You're not getting information. You're not getting, you know, the issues around stigma. You don't want your family to know. And so I think it's really important to look at it through that lens rather than this individualistic, oh yeah, they just out there like that. No. It's far more complicated than that.
Wow. I wish you could do another part 2 to this.
We can.
Yes.
If you would allow us, Dr. Bole,
This is so fun. I didn't really know what to
we would love to come back. We would love to come back and talk more.
I feel like we're just like chilling. I'd be happy to do a part 2.
And also I say that because Takuma has like 78 other questions. That's for real. That's for real.
I can see that. And Takuma, I want to say that the questions you've asked have been so insightful, so just wonderful. I mean, I didn't know what to expect. I didn't know what we'd be doing.
He is a hardcore, real deal journalist. I mean,
no,
real
deal.
Deal.
It's clear from the question.
Not playing with it. Not playing with it at all.
That's quite clear to me. Quite clear to me.
I do have one last question. I wanted to ask you, like, what tips, what pieces of advice would you have for our audience who really care about our community and want to do something about this issue with HIV and AIDS?
I would say get involved, find opportunities to volunteer at different HIV organizations, get informed. You know, everybody's got, I call it Dr. Google. Everybody's got Dr. Google in their pockets. Get informed so that you really understand what's happening in our communities. Protect yourselves and those you love. Use condoms. You know, find out about PrEP. Find out about PEP. PEP is post-exposure prophylaxis. It's sort of like the plan B of HIV, meaning if you've been exposed, you can get these pills that will greatly reduce the virus or the transmission of the virus. But you really need to be informed. For men who are having sex with women, particularly since you know you have greater control of condom use, you be the one to raise the condom issue and to have the conversation and to have the condoms available. And you also be there to respect the woman who says, no, I don't want to have sex without a condom, or I don't want to have sex at all under these skirts. It's a conversation that we should be having. And so that's what I'd want. Oh, and that it ain't over. The HIV epidemic is, we can look forward to, they have all these plans ending the HIV epidemic as a sort of new initiative. And from what we're seeing, we can look forward to ending the HIV epidemic by 2030 for white people. It's not over for our communities. And so we really need to keep that in mind.
What was
And
that
so
study?
dismal note.
What was that study, Dr. Bole? You said something sex empower, love sex empower. Is that what you said?
It wasn't a study. It was Hortensia Amaro. She did a paper in 2015 in American Psychologist called Love, Sex, and Power.
Whew, I got to get my hands on that.
Yeah,
Just that power dynamic, especially when you talk about condom usage. I mean, I could see that's a direct connection.
Oh, totally. And we got to talk about that power imbalance that exists in many heterosexual relationships, because that's the crux of the conflict.
Well, Takuma, we might have to talk more about condom and condom usage in general. I mean, that's especially for young people. There's a whole dynamic in that. I mean, you know, having parents drop off kids in college. I'm here in Tallahassee, Florida, Dr. Bole, Florida A&M University, watching kids drop off, you know, students. I'm sorry, watching parents drop off students, and student health services having condoms and things of that nature. It's really arming them to protect themselves. But of course, as a parent, you can watch the reaction of like, whoa, what's going on? Like, it's almost encouraging. Well, it's not encouraging. I mean, the reality is it's going to happen anyway, because this is what young adults do, just like when those parents were young adults and they did it also. But clearly, as parents, we're different people than we were, right? So you think differently. So it's a whole dynamic there, right? I mean, wouldn't you want that young man, those young ladies, to have, you know, something with them, as you said, Dr. Bole, or to be able to say, if you don't have one, I have one, right?
Right.
If you're gonna be in the mix anyway.
That's
It's a lot there. And you know, even what you were referencing, that DC to Jackson, Mississippi, right? The environments alone, that's a whole nother discussion, you know, in itself right there. So yeah, there's a lot of work to do. We know that.
Mm. Wow. Well, Dr. Bole, thank you so much for your time. This has been so enlightening. Thank you.
Oh, wonderful. It was my pleasure. Thank you so much for inviting me to speak. Like I said, I didn't know what we were doing. You see, I'm wearing sportswear. I didn't know what we were doing.
Looking like a queen. Thank
you. But I enjoyed it, and I would welcome a part 2 whenever you'd like.
Well, we will do it again. Indeed. Mm-hmm. We would love to have you back, and creating, or at least seeking your guidance to create more on our platform so we can inform, as you said.
Well, actually, wait, and I got to ask before we go, because we're always looking to recruit, particularly men in your network in the Washington, D.C. area. We're always in, so if there are opportunities for us to sort of send our flyers about our different studies, but they have to be in the, as they say, the DMV area.
Yeah,
Mhm.
send us what you have, because we would love
Yes.
to, as we continue to, expand our reach, making sure that we can create targeted information for men wherever they are. I want to, as Takuma knows, it's difficult, Takuma, start referencing, kind of those demographics when you start talking about age and things of that nature. And I always say, I want to reach Black men wherever they are. So for me,
Yeah.
that doesn't get into age and location. Like, again, some of those same challenges and struggles that we've talked about today. It doesn't matter if you're 17 or if you're 55, you're still a Black man. And the
Mhm.
same thing with some of these health issues also. So yeah, please do send it along. We'll be happy to do our best to get it out.
Okay, sounds good.
Absolutely.
All
Thank
right.
you.
A pleasure. Be well.
Thank you so much,
Great
Dr.
talking
too.
Bolek.
Take care. Bye-bye.
Respect.